there's been emerging evidence over the last couple of years that men who are taking 5-alpha reductase inhibitors at the time of prostate cancer diagnosis have worse outcomes in terms of prostate cancer specific mortality, metastasis, and even higher grade disease at diagnosis. The hypothesis that came from these studies was that 5-alpha reductase inhibitor use led to delayed diagnosis of prostate cancer for the reason that 5-alpha reductase inhibitors decrease PSA levels by 50% without decreasing prostate cancer risk. And so what happened is a man could have what appears to be a nominally normal PSA and get referred and not be referred when they should have been referred because the numbers should actually be doubled. So the purpose of this study was to actually confirm that hypothesis that it's actually delayed diagnosis that leads to worse prostate cancer outcomes as opposed to something inherent to the 5-alpha reductase inhibitors. So what we did was we took a look back at our patient population here at Atrium Health of all men ages 40 or greater in the years 2018 and 2019 who had a PSA check. It was a little over 91,000 total people in the population, of whom about 3,000 were 5-ARI users, or 3%. Of our 91,000 men who had PSA testing in the 2 years, we found that about 3,000 were taking 5-alpha reductase inhibitors, which gives us a sense that about 3% of the male population over age 40 is using these medications. 5-alpha reductase inhibitor users were older, 69 years median age versus 59 years median age, but interestingly, had exactly the same nominal PSA as non-users. So the PSA median for 5-alpha reductase and 5-ARI users, uncorrected, was 1.1, whereas in the non-users, it was 1.0. And in this large cohort of 2,939 5-ARI users and 88,429 non-users, the p-value between those two was 0.6. Given the very large data set, we can be very confident that there is no statistically significant difference in this case. Furthermore, if you take the next step forward and use the information available in the electronic health record, or EHR, to assess prostate cancer risk in 5-ARI users versus non-users at just their baseline, just the average person who's getting PSA testing, 5-ARI users, according to the prostate cancer prevention trial risk calculator, have about a 5% risk of high-grade prostate cancer as opposed to 2% in non-users. And if you use the successor to the PCPT risk calculator, the PBCG, or prostate biopsy collaborative group risk calculator, you see a risk of 17% versus 6% in non-users. We then took this a step further and took a look at men who were referred to urology specifically for further evaluation for prostate cancer. So basically, these were men who had a referral from primary care to urology for reasons such as elevated PSA, abnormal DRE, or just concern for prostate cancer, please obtain prostate biopsy. And in this subset of our patient population, it was about 3,500 men, 99 on 5-ARIs and 3,420 who were not on 5-ARIs. The populations were fairly similar, although again, the 5-ARI users were slightly older at 69 years of age versus 64 years of age median. But very interestingly, the PSA at referral was again statistically the same without correction. So 5.8 nanograms per milliliter in 5-ARI users and 5.6 nanograms per milliliter in non-users. When you do the correction, we found a highly significant, both statistically and clinical difference between users and non-users, in that 5-ARI users had a median corrected PSA of 11.6 at urology referral compared with 5.6% in non-users. This again translates to higher risk once we apply the risk calculators as well. And according to the PCPT, there's a 21% risk of high-grade prostate cancer in users versus 10% risk of high-grade prostate cancer in users at the time of referral. And according to the PBCG, it's even higher. So the PBCG predicts a 48% risk of high-grade prostate cancer in 5-ARI users versus a 28% risk in non-users. So these data help to confirm the hypothesis that was generated from previous studies suggesting that men on 5-alpha reductase inhibitors truly do have higher risk at referral. And it's likely because the effect of 5-ARIs on serum PSA isn't necessarily being considered.